Now, it appears the NLC's court action to compel the nurses and midwives back to work has not been successful. Now they have escalated the strike. This must be a disturbing development for you, even as a member of the Health Committee.
For sure. The health sector is meant to help the sick who are in need of support to heal, to get well. That is the essence of the health sector, treat the sick people who unfortunately fall ill.
Forgive me, Doc, your line is a bit faint. If you could reposition yourself so we are able to hear you clearly, please.
Right, okay, clear. Let me just move out of this room. And then I'm saying that the health sector is positioned to help those who fall ill. So anything that would hamper the service delivery is a cause to worry about. Definitely, the strike of our nurses is a very big problem for us because, as we all know, they form the chunk of the staff of the health sector who provide services. So going on strike will definitely affect all Ghanaians. Even those who are not at the hospital would even go into panic because there's no hospital in case they fall sick. So it's a worry to us.
And indeed, when you look at Section 163 of the Labour Act, Act 651, it actually prohibits strike by essential service providers like health workers. And I'll just read that section to you. It says, an employer carrying on or a worker engaged in an essential service shall not resort to a lockout or strike in connection with or in furtherance of any industrial dispute involving the workers in the essential service. It seems this has been abandoned.
Yeah, it has clearly been abandoned, and that has gone against the Labour Act. That is why I think that the court has ruled that they should go back to work and then negotiate. In case you know, I've been one of the people who have always advocated against health professionals going on strike, but rather use dialogue to reach their objectives when they are negotiating with government. So this strike, as we all know, has come with some mixed feelings and between the nurses themselves. From what we know, this was signed as far back as last year, May, was not implemented. And now they are asking for it to be implemented immediately because an agreement is an agreement, it must be implemented. No one doubts and disputes that fact. But some group of nurses have come out to say that, look, they are not going to join the strike for compassionate reasons. And we can see that the Ghana nurses, the Ghana Registered Nurses and Midwives Association stood out alone to insist that they must go on a strike to demand for a full implementation of the policy, the conditions of service that was agreed on with the previous government. Yes, but we all understand that for any company to fulfill conditions of service, let's say Ghana as a company, like TV3, you demanded for conditions of service, but the company believes that the new CEO has just come in and has to check the records, has to check the funding sources, whether they will be constant or not. What the other government saw, the other CEO saw before assigning this, the new CEO must analyze it to see whether actually he can meet it. If even he can meet it, does he have all the money available instantly to meet the conditions, or there is a need to approach this in a gradual process?
So you think that the nurses and the midwives are not being considerate?
They are very considerate. I've not said that. I'm only explaining what would be the problem. If they are not considerate, I haven't said it. I've only said that the previous government didn't receive this type of pressure. The one who signed it, the government that signed it, didn't receive this pressure from the nurses because perhaps they gave them reasons. They should give us the reasons why the previous government told them that they hadn't even commenced implementing the policy.
So I just want to, forgive me, Doc, I just want to understand the import of the analysis you're making. In a nutshell, what are you exactly saying as
what
regards the position?
The government has called them to the table to come and they will sit down and draw a roadmap. The government has formed a 3-man committee to work to ensure that the conditions of service is rolled out.
So for you, they should have given the government...
You may roll out implementing one issue after the other.
So
perhaps
they should have given...
There is no money to implement all at once. And we all know the situation of Ghana. You yourself, you know it.
So what you're saying
is... it is not that the names are not considered. It's the leadership. To me, that may have a problem.
The leadership of this group has a problem.
Some of the leadership may have a problem.
So essentially what you're saying is that they should also bear with the government
They should bear with the government and allow the process to be rolled out gradually so that we all synchronize the needs and at least implement it. I'm not saying they shouldn't get it. No, I'm far from that.
Let me ask you my last question.
Government, get the roadmap. If it is fuel, how would they start? If it is your health insurance, how would they do it? If it is an overnight allowance, how would they implement it? Would they start from one after the other and implement it as the economy is improving?
Let me ask you.
Because we have seen conditions of service implemented in this country. The doctors own. Up till now, they are not implementing it 100%.
Doc, for the sake of time, let me ask you my last question, and if you could answer that in like 30 seconds. As a member of the Health Committee, is there anything you could do to help?
What we can do to help is to appeal to the nurses to go back to the drawing board to see how they can roll out the implementation of this policy that they brought out as their conditions of service.
We'll have to end it here. Dr. Thomas Anaba, Member of Parliament for Garu and member of the Health Committee. Thank you very much for speaking to us.